First of all, I'd like to thank the committee of this meeting to invite me to address this conference today. And we're going to talk about hormonal modulation and anti-aging medicine. I believe that anti-aging medicine is the medicine of present and the future. Why is that? Because we are in the era of prevention. And hormonal modulation is very important to balance physical, mental, and emotional status. I believe that hormonal modulation is a pillar of anti-aging medicine. We are living longer, and life expectancy requires hormonal modulation therapy. Why is that? Because we're looking for living longer and with a good quality of life. In the hormonal modulation, we do hormonal balance. Hormonal act synergistically. One affect the other's function, the production, the response, and the cell receptor sensitivity. And my experience with anti-aging medicine started in 1995 when I first attended to A4M meeting in a resort in Las Vegas, and I really found myself. As an endocrinologist, I took my post-graduation course 42 years ago. I'm 68 years old this year. And I really found myself because I always had an approach of prevention in my practice. And I thank Dr. Klatz and Dr. Goldman to start this wonderful association. What we do when we prescribe a hormonal modulation, we correct the hormonal deficiency and we correct the hormonal overproduction. Aging process is associated with a lack or drop of many hormones in our system, like sexual hormones, DHEA, growth hormone, thyroid hormones, and melatonin. But it's also associated with the increase of some of them, like insulin, cortisol, and the PTH. Endocrine system, it works like a big orchestra, as mentioned Dr. Klatz in his first book. And also deficiency and overproduction of hormones, they're going to induce diseases associated in the aging process. So we're going to speak first about the human growth hormone. It's basically anabolic proteic, so induces cells multiplication. And the benefits of use of this hormone in the elderly are based in the sharp decline of growth hormone in the old age. Growth hormone restores muscle mass, strength, and in adults with deficiency, it accelerates the healing of surgical wounds, what used in England many years ago in the early 90s. It's very important for the immune system, and it was used before to prevent and reverse cachexia in HIV patients. The secretion of growth hormone is done in pulse, is a single chain of amino acids, has no glycogen in its molecule, and values range from undetectable until 40 micrograms per deciliter. And the secretion is affected by food. Some factors increase growth hormone production, like somatotropin, is the GHRH hormone produced in the hypothalamus, hypoglycemia, amino acids, and acute stress. And other factors, they decrease growth hormone production, like IGFs, somatomedin. It has a negative feedback with the level of growth hormone. Hyperglycemia, chronic stress, it's very important, and it drops in the aging process. How we evaluate growth hormone deficiency in the aging process? Through IGFs. IGF means insulin growth factors. It mediates growth hormone action. And is a polypeptide produced in most of tissues, especially liver. And we can find free molecule or linked to a protein called IGF-BP that goes from 1 to 5, and the most important is IGF-BP3. So IGF, especially IGF-1, mediates the physiological actions of a growth hormone, and the fraction linked to a protein modulates the actions of IGF in the target cells, and also changes the bioavailability of IGF to the tissues. So how we check IGF, how we check a growth hormone in adults with deficiency? Through measure of IGF. So IGF reflects the production of growth hormone in the last 24 hours. When you suspect in a younger adults of some kind of disease like a tumor, or in children, to be sure that this child has a deficiency of a growth hormone, we do dynamic tests with insulin, propranolol, glucagon, etc., and we test growth hormone. But in adults, we test just IGF. I do IGF-1 and IGF-BP3. And I think, depending on the age, IGF should be between 200 and 250. Administration of growth hormone should be parenteral because it's a single chain of amino acids. If we swallow, we're going to digest and lose its metabolic action. And the first evidence of use of beneficial growth hormone in adults with deficiency goes back to 1962, so it's very old.